Does your dog's breath stink? Did you know you were supposed to brush your dog's teeth? Your dog's teeth are just as important as your teeth are, and they should be brushed daily. Most people brush their dog's teeth every other day. To be honest with you, it's not as effective. It does help, but it's not as effective. Dogs and cats should get dental cleanings at least once a year. However, the smaller breed dogs need dental cleanings probably every 6 to 8 months if you're not brushing their teeth at home. Not taking care of your pet's dental health can lead to periodontal disease, heart issues, kidney issues, liver issues. So just brushing your dog's teeth once a day, which can be a challenge and a task, can minimize on disease in your pet's health. So what you want to do is, ideally, you want to do this when they're a puppy so that as they're getting older, they're getting used to getting their teeth brushed, with you handling their mouths. They won't fight you as much. The trick is to use treats and find a toothpaste that they actually enjoy. Some dogs and cats don't necessarily like the taste of certain toothpaste, so you want to be very careful when selecting one, and sometimes don't necessarily use the toothpaste when you're brushing the teeth, but just use it to see if they just like it before you actually try to brush their teeth with it. I found that some owners are using a toothpaste that the dog or cat just does not enjoy, and they tend to fight you because they hate the taste of it. So this is Memphis. This is my baby. So Memphis is pretty used to dental cleanings. So normally what I do is just lift the lip, and as you can see, he's already prepared for me to brush his teeth. So he's lifting his lips for me. All right, and sometimes you'll find that certain toothbrushes, they have a finger toothbrush that you can use to get the pet used to it. But you basically take the toothbrush with the toothpaste that the pet prefers, and you actually just very gently go around the gum line and brush the teeth. If you find that they're very painful, you don't want to keep going because that can teach them that dental cleanings hurt. If it's too painful, if the gum line is bleeding, you actually may need to call your veterinarian to schedule a dental cleaning before you actually go into brushing the dog's teeth. So Memphis is pretty used to this. So he likes to chew and taste the toothpaste as I'm brushing the teeth. But as you can see, I'm being very gentle with the toothbrush. There are different firmnesses to the actual toothbrushes. So some pets may prefer a softer toothbrush compared to a more firm one. And as you can see, he's got a little bit of bleeding, which is likely due to the tartar buildup. He gets dental cleanings every 6 months just to prevent us from having to take the teeth out. So that's pretty much the gist of it. Now, there are products you can use to minimize dental tartar buildup. One is an enzymatic mouth rinse that you can put in their water. They also have dental chews in addition to dental wipes that you can use. When I brush my dog's teeth, I always tend to spray chlorhexidine, which is the same thing that our dentists use, and just kind of spray it around the gum line to minimize infections. So, and say that's pretty much it, huh? And I always give them a treat afterwards, because they not only do they enjoy dental cleanings, now they enjoy the treats because they know after a dental cleaning they're gonna get a treat. And these are homemade, all organic, Enjoy Your Bones. You can find this brand by searching the website, and it should come up very easy for you. Thank you for your patience, Pippi. This baby is just presenting for blood in the stool. We actually don't know what's going on as of yet, so I'm just doing a physical exam to try to see if I could figure it out. Most often, you don't see anything on physical exam when a pet is vomiting and having diarrhea. The symptoms are kind of vague. So Dad brought in a poop sample, and I'm just trying to look at it to see what it looks like. In veterinary medicine, we use all of our senses, so we smell, sometimes taste, of course see, hear, but most of all, we like to examine the poop to make sure that there's no parasites, etc. So just looking at it gives me an understanding for what the pet may be dealing with. Disgusting. So I am doing some reaction videos. I'm quite excited to see what my own response is gonna be. So let's see what we got here.
My head. Get off.
Would anybody like a cat? Anybody? It's okay, Daddy.
Why is that cat in her sink?
You don't get on the counter. Get down. Get down. You know better.
They're human. They really are. I don't kiss cats.
I'm sorry.
I will use you and do cutlets. Yeah.
Why she got the cat paws on her face? That was just nasty as hell. Yeah, I ain't good. I'm not good at this. She got the cat making biscuits.
On her face?
Yeah. I had all kind of whelps and disgusting. No. And then one was kissing the cat. Do you know what I see on a daily basis? I can't do it. I cannot do it. If you kiss cats, please sit on the other side of the room. I can't do it. So this patient came in today because the owners have noticed a lameness that has been present since dog was a little bit younger. Not really knowing or understanding why the lameness is there. So the owner brought the pet in for us to investigate a little bit. And we noticed that there was a swelling on the left ankle in addition to the right knee. So happened to take x-rays and we noticed pretty severe arthritis in the joint space, which likely has been there for quite some time. So we use Librela long-term to kind of manage arthritis and inflammation. Of course, there are other medications, but they are metabolized by the liver and the kidney. So we try to use something that's not going to affect the organ function long-term if a pet may have chronic arthritis. So this pet is chronically lame every single day, but it's hidden by the muscles that kind of cover up the lameness. So this is a pet that will unfortunately need to be on anti-inflammatories for the remainder of life, just to manage the inflammation and pain. And ultimately we'll check in to make sure that it's not getting worse. One thing that can be done is weight loss in order to minimize the amount of pressure and stress on the joints, and that may also help the pet get around a little bit better. So if you see your pet limping, not wanting to jump in the car, or just not doing things that they typically would do, you may want to schedule an appointment to get a musculoskeletal exam just to make sure that there's not anything serious going on. She got a really bad recessed vulva. So this is what we call a recessed vulva, or a hooded vulva. If you look, it's kind of surrounded by skin folds. You can't really actually see it, but if you push upward, you can see the complete vulva. So yeast and bacteria can live inside of here, get into the vaginal tract, go upstream to the bladder and cause a urinary tract infection. So not sure if this is the first UTI or if she's had them for quite some time. The bacteria also changes the pH of the urine and start allowing stones to form. So she could have bladder stones as well. I'm gonna try to get some urine from her. So for a urinary tract infection, we typically get a urine sample to do a urine analysis. We call that a urinalysis to see if there's any bacteria or crystals in the urine, but when we can't get a sample, that's quite difficult. It does not look like she has a bladder at all, so the options we have is to keep her here and monitor her until she develops a bladder so that we can get a sample, or just treat for a UTI blindly. When they don't have any urine in the bladder, it's very difficult to see if they have stones with the ultrasound. So the next step ultimately would be to take an x-ray and kind of go from there. So this baby actually urinated multiple times in the car because she just can't hold it. I'm sure she has a itchy sensation that's causing her to feel like she has to urinate. So if your baby is having accidents in the home, urinating multiple times inside, they may not necessarily be being disobedient. They could have a urinary issue. So just make sure you book an appointment, because we can test their urine to make sure they're not just being disobedient, and ultimately they may have a medical issue. You sound good. You like a Bronco. This is a pet that came in for having some issues. So initially I'll start with a physical exam to make sure it's nothing I can just blatantly find. Most times if it's vomiting and diarrhea, the symptoms are pretty vague. So normally you won't find anything on physical exam. This pet is not up to date on prevention, so it could be something as simple as parasites or something as serious as pancreatitis or something like that. So, all right, family. So today I'm going to educate you all a little bit about a contagious respiratory disease in dogs called kennel cough, better known as Patella bronchiceptica, which is a tongue twister, by the way. Kennel cough is normally seen in places where there are multiple dogs at one time, such as grooming, boarding facilities, daycares, and let's not forget about dog parks. The symptoms normally consist of a honking cough. Normally the patients will become very excited, and that's when you'll notice the coughing episodes. It's normally self-limiting, which means over time it typically will go away on its own, but we also try to provide supportive therapy to help with the coughing, soothe the trachea, which is the windpipe, and also just make sure that they don't go into more complicated situations such as pneumonia, fevers, things like that. So if you are going to take your pet to any of those places, you want to make sure you get the kennel cough vaccine, which is a very easy vaccine to administer. It's not very expensive at all, and it can protect your pet from becoming ill with kennel cough. A vet visit to treat kennel cough typically, I would say, ranges from $200 to $400 depending on which facility you go to, but the vaccine itself is less than $100. So if you get the vaccine on a preventative basis, you can save yourself a lot of money. So if you need help, have any questions that we can answer for you, definitely give us a call and we'll be happy to help. So Mason, who is a mixed breed dog, came in with a history of having vomiting and diarrhea. She's a very anxious dog, so my suspicions is that stress may have played a part in the diarrhea, but we always want to do a full workup to make sure we're not missing anything. Based off of the history of the pet's diarrhea, vomiting, etc. She also gets human food, which could complicate my suspicion of stress colitis. So we also recommended doing a pancreatitis test to make sure the baby does not have pancreatitis. Sometimes owners just elect to treat more conservatively, so we never really get to figure out what caused the symptoms. So we treat them, monitor their response to treatment, and if they don't get better, ultimately they'll have to do more. But this pet definitely has a history of diarrhea that's not related to food or any allergies or anything like that. So I suspect that it is stress, which there's no true diagnostic test to confirm. So we are going to treat today and then kind of see how the pet responds to that treatment and go from there. So this is a patient that we treated for a hot spot, and I just noticed the baby also may have an ear infection. So all of this may be secondary to allergies. So I'm going to do my exam, kind of see what I find, and then I'll talk to the owners about what needs to happen next. Just so I can keep it clean and it's not holding moisture, and also we'll use an antiseptic solution so that the owners can treat it topically at home. Yeah, so hot spots typically happens sometimes secondary to allergies, but also if it's a dog that holds water in their fur after they drink water, or just moisture in general, it can kind of predispose them to having a hot spot. And it is very painful, and they typically don't do too well with you shaving it. So most times we normally have to sedate them, but this baby's doing pretty good. So I'm gonna use this antiseptic solution called chlorhexidine and just clean the wound. Now this works by contact time, so ideally you want to put it, put it on the skin and let it air dry, because the longer it's on the skin, the better it works.
Okay, Bubba.
And again, it's very uncomfortable. So 10 to 14 days, they normally should heal up just fine. Feel pretty good. But we need to treat its allergies, because I think it has an underlying allergy that may be getting missed. So we have 2 kittens coming in for their last set of vaccinations before they can be considered fully vaccinated. Of course, they still need to get a rabies, but they're okay with their upper respiratory vaccine. So far, they've been healthy. The owner found a litter on the side of the road and decided to just rescue them. So they've had them since. They've been quite healthy, so the owners got lucky with them. But today we'll see what they look like and kind of go from there. This is a kitten that came a couple of weeks ago, 2 or 3 weeks ago, for initial vaccines. So we're just finishing up their vaccine protocol. It's technically a tech appointment, so they don't necessarily have to see a doctor for their last vaccine. But we just like to make sure that if I can look at them, I will, just to make sure they're healthy. Let me grab my stethoscope. When you get a new kitten, you really want to know where the kitten came from, because if it's a stray, it can carry a lot of different viruses. If you have other animals or other cats at home, you definitely don't want to commingle them, so it's best to isolate them until you know their parasite status, whether or not they have viruses. Because some of them aren't necessarily clinical, so they look perfectly normal, but they can be carriers of illnesses. So yeah, they can be quite tricky. Yes, so a lot of times when you find kittens outside, they could be infected with herpes virus, calicivirus, and those are viruses that typically cause congestion, upper respiratory symptoms. So definitely isolate them for, I would say, even 2 or 3 weeks, just to make sure no clinical signs develop as they're, as you're watching them at home. It ain't that bad, dude. He's very hyper, so we have to try to restrain him different ways. But we did a laceration repair, and he had some sutures that needed to come out. So it's been a unique way of handling him, but we seem like we figured it out. Okay. All right, Bubba.
All right.
That's the easiest appointment I think he's had. He's very hyper, so we gave him, he's actually on anti-anxiety medications, but it didn't really work. Yeah, some pets come in and they're already hyper, so we try to keep them as calm as possible, but it don't always work. Of course, I have a female staff and I'm stronger, so sometimes I may have to restrain them. Truth or myth, Soft Paws Animal Clinic edition. No, cats need vet visits every year, regardless of whether they're indoor or outdoor, because there are some illnesses that can develop. That's a myth. Not necessarily. My dog loves grass. She loves the taste of it, and she's perfectly healthy. There's nothing wrong with her. Yes, most definitely. A lot of health issues come from dental disease, so it's best to brush your dog's teeth at least once a day. If you can't brush your dog's teeth, I would recommend getting dental cleanings every 6 months, 6 to 8 months. No, we see fleas and ticks year round. They're less likely to become an infestation in the wintertime, but they can transmit disease in the winter and also infestate pets as well. No, that's false. Grain-free foods for dogs that may have allergies may help their allergy, but we've seen that grain-free food leads to heart disease in dogs. So I'd rather treat allergies than to treat heart disease. Once the heart muscle is damaged, it cannot be repaired. So definitely do not feed grain-free dog food. I would recommend you consult your veterinarian about that. So this is a baby coming in with a history of crunchy sounds from the mouth. So we suspect that there may be a dental issue. So we're going to do an exam, try to figure that out. And indeed, the owner does want a blood sample in case we do need to do an anesthetic procedure. So we'll actually collect a sample and get it sent out to the lab to make sure that the baby is healthy enough for a dental procedure. So she has a fractured tooth on her upper right arcade that I think is causing her some discomfort. It does need to be extracted right there. Not sure if you can see it through the camera, but that tooth is causing some discomfort. That's causing her to chatter her teeth together, and the owner noticed that. So she needs an extraction. So we're going to get a blood sample in preparation for a dental procedure.
Have you ever noticed your dog scratching at their ears or shaking their head a lot? That could be a sign their ears need a good cleaning. Ear hygiene isn't just about smell or comfort. It's about preventing painful infections. Dogs with floppy ears or who love swimming are especially at risk because moisture and wax buildup create the perfect environment for yeast and bacteria. This sweet patient came in with redness, irritation, and that classic yeasty smell. After a thorough ear exam, we found a yeast infection. We cleaned the ear canal carefully, treated the infection with medicated drops, and now this pup is feeling so much better. At Soft Paws Animal Clinic, we recommend checking your dog's ears weekly. Look for redness, discharge, or odor. If you notice any of those signs, don't wait.
All right, so this baby came in for a second time with wounds from a cat fight. A lot of times that happens when they are not neutered, so they get territorial. So today we are going to neuter him, and hopefully that'll prevent the issues in the future. But he's a young and spry cat, so a lot of times they get into situations that cause issues. So he'll definitely need to be put on antibiotics and anti-inflammatories. A feline neuter or cat neuter is pretty simple. Recovery downtime is almost nothing. They recover very fast. So it's very easy. So if you have 2 cats at home, a male and a female cat, it probably would be less expensive to take care of the male cat first, because it's very easy to do. Ideally, you want to neuter them before they hit sexually maturity to prevent them from marking territory, urinating in the house, etc. And that typically happens, it can happen very early in cats, so anywhere from 3 to 6 months of age. So this is a wound caused by the cat fight, and what I'm doing is shaving the hair from around it. I'm gonna debride it, which is kind of get rid of the dead tissue, just to try to get it back healthy again to prevent infection. Yes, this cat will be tested for FIV and also FELV to make sure that we don't have any viruses that can be contagious and transmitted through actual cat fights. So ultimately, this owner does have multiple cats in the household, so it's going to be very important that she gets them fixed so that they're not fighting as much. And also she may actually want to separate them if they just can't get along. So we'll get this baby cleaned up on antibiotics, pain meds, hopefully feeling better, and we'll see him again in about a week just to make sure everything healed up nicely. So this baby is coming in for a lameness exam. She does have a history of kneecap luxation. We call it patella luxation. So it seems like her patella is actually stuck out of place. So she's actually limping, which is concerning the owner. So I just put her knee back in place, but it's popping right back out of place as we speak. So she's probably gonna need surgery to correct the position of her actual kneecap, because that's what's causing her lameness. It's not necessarily painful, it's more of a mechanical issue. So, well, she has patella luxation on both legs, but the right one's only causing the issue. I'm gonna put her down to see if she's walking better, but probably not. And she's gonna need surgery. Come here. Come here. Come here. So the surgery will deepen the groove where the kneecap's supposed to sit, and actually kind of tack it in place so that it does not go in and out of place again. They basically have iron knees after that. This is the #1 killer in senior cats, and 60% of owners miss it. Chronic kidney disease in cats is among the most important disease in older cats that cause them to have a very slow decline. Some symptoms include vomiting, inappetence or lack of appetite, excessive drinking of water, peeing outside of the litter box, or not seeing urine at all in the litter box. Chronic kidney disease cannot be cured, but it can be slowed down. We often only see evidence of kidney disease in pets when at least 75% of the kidney is damaged. If 75% of the kidneys are damaged, we will see evidence of it. And although the kidneys cannot heal themselves, we can try to medically manage it to the point to where we can slow down the progression of the disease. Most often, unfortunately, chronic kidney disease is fatal, but we can manage it very well and give you more time with your baby at home. The earlier we catch it, the better off it is. Some things we do includes changing their diet, providing different supplements, and also providing fluid therapy at home for the owners that's capable of doing that. So definitely look out for the symptoms. If you see anything outside of ordinary, you want to definitely get your pet seen by us so that we can kind of help you out. Also, there are litter boxes available that monitors the activity in the litter box. So if your cat's having any issues regarding the symptoms of chronic kidney disease, this can be caught on annual lab work. So be sure when you go and get your vaccines, you're not declining the lab work, because that is the only way we can typically catch it before it becomes life-threatening. All right, so this is a pet that came in. The owner was concerned about itching, scratching. I'm sorry, Bubba. itching, scratching, hair loss, of course, but just looking at the pet with my experience, I suspected that the baby had flea allergy, dermatitis, and what that is one flea bite can cause a systemic allergic reaction to really the flea saliva, so the pet ends up losing hair, becomes very itchy, and a lot of people may think it's allergies, but it's more of a flea allergy, not necessarily environmental allergy. So yeah, we found fleas on exam and we kind of alerted the owner. So this is a different one, but you can see the hair is also pretty bad. Same owner. Yeah, so these pets are from the same litter. So most of the time they are going to have similar allergies due to their immune system and genetic makeup. So if one has an allergy to fleas, it's a high possibility that the opposite one will have the same thing. So we just treat both of them and kind of see what happens. Had they been on a monthly preventative, they likely would not have flea infestations or even flea allergy dermatitis going on right now. So just make sure your pets are on monthly heartworm, flea, and tick prevention so you don't have to experience this. So sometimes at dog parks you will notice that energies change very fast. So you have to be careful you're paying attention to your pet, because at any moment the energy changes and one pet may get more aggressive than the other, and then you get into a fight. So when they're off leash and they're playing and enjoying themselves, that can be very dangerous because you may not be able to get to them in time. So make sure you're very close. Wherever your pet is, you need to be literally steps away if you can help. If you know that your pet is prone to ingesting things such as rocks, sticks, anything that the pet may see at the dog park, you may want to invest in a basket muzzle, which you'll see in the video here, and that can prevent them from picking up things, although they can still ingest water, treats, different things like that. It's a safety mechanism so that when you go out, you don't have to worry about the baby ingesting a foreign body. So I wanted to talk to you all today a little bit about what we call brachycephalic syndrome in dogs and cats. Most breeds in regards to dogs would be a French bulldog, regular bulldog. Sometimes you'll get pugs that has a pretty bad case of brachycephalic syndrome, in addition to Maltese breeds. Brachycephalic syndrome is exactly what it says. It's a syndrome that composes a lot of different medical issues simply based off of the breed of the dog. So a lot of times you'll start seeing respiratory issues, and that's due to a very small opening in their nose. They typically also have elongated soft palates, hypoplastic tracheas as well. All of these things cause difficulty when breathing. It also causes them to overheat very easily. So if you have a brachycephalic breed, please note that you don't want them to be overweight, because if they have more fat on their body, they also is going to have more fat in their throat area, pretty much all of their respiratory areas as well. Additionally, they exert more energy simply just by walking and things like that. All of these things cause them to easily overheat.
Somebody's watching me, is my anxiety.
Oops.
Action.
Oh,
Hi, I'm Cashmere, and I'm an intern here at Soft Paws Animal Clinic in Arthritis. My favorite part is being taught by our doctor, Dr. Jackson. I learn a lot of new things every single day that I plan to apply, not only in undergrad, but as I matriculate through vet school. There was a surgery Dr. Jackson had did for a pyelometria, so we had to take the uterus out of the female dog. That was the most craziest thing I've seen so far. Favorite patient breed? I wouldn't say I have a specific breed, but I do like larger dogs over like smaller dogs or cats, things of that nature. My dream animal to treat is actually a rhinoceros. On Instagram recently, I seen this video of these veterinarians in a safari doing CPR on the rhino, which is really interesting because my the route I want to go through is wildlife. The best part of working here is really just the amount of knowledge and practical and hands-on skills I get each day I work here. I've learned a lot working here, so much where I do think once I start matriculating into vet school, I will have more of a foundation when it comes to learning things, so I can really build on that and be an even better vet. Thank you, and if you have a pet dog or cat and they have some type of issue, feel free to come to Southport Animal Clinic and Urgent Care. We'll be happy to help.
Beautiful.
All right, so one thing that concerns me most is intestinal parasites with dogs at the dog park. So of course we do see a poop sample here that's actually quite old. So what happens is if a pet has parasites, the eggs will hatch in humid, moist environments such as the ones we're in now. So we don't know how infested the grass area is with parasites. What that means is if you bring your pet to the dog park and your baby's not on any heartworm, flea, tick prevention, no gastrointestinal parasite prevention, your pet can pick up parasites simply from being at the dog park. So these are things you can't see. Ultimately, the only thing you can do is get your annual exams, annual fecal testing, and then just try to be as safe as possible. But make sure your baby's on parasite prevention so that you don't have to worry about it. Do keep in mind that the parasite prevention does not protect the pet from all parasites, only the most common ones. So you still need to get the pet examined and fecal testing done just to make sure that the pet doesn't have any parasites at all. All right guys, so today the educational video is going to cover a very important topic that could potentially be life-threatening, and that is diabetes in cats and in dogs. Diabetes in cats and in dogs a lot of times go unnoticed by the owners because they simply do not know what to look for at home. So today I'm going to tell you what to look for to make sure your pet is not suffering from diabetes. Number one, diabetes normally causes your pet to drink more water and urinate much more. Some owners may suspect a urinary tract infection because the pet may be having accidents in the home. The urine potentially could be very clear, but the difference between a urinary tract infection and diabetes most often is that when diabetes happens, there is a lot of urine at one time. If it happens to be a UTI, most of the time it's going to be a very, very small puddle. If we don't catch diabetes in time in your cat or your dog, it can turn into life-threatening ketoacidosis, which can cost your pet its life. One of the simplest ways to check for diabetes is a urine sample to see if there's any sugar in the urine. One other way we can test to diagnose diabetes in dogs and cats is to do a blood sample and run it on our blood work machines. A lot of times we'll see that the blood glucose levels are elevated, which will kind of point us in the right direction, which we'll run a couple of other tests just to make sure of, and then get the pet started on insulin depending on the type of diabetes the pet may have. So if your pet's drinking a lot of water and peeing a lot, book an appointment as soon as possible. Did you know your dog can die from getting bitten by a mosquito? One mosquito bite can cause heartworm disease to develop in your pet, and it can be, and most often is, life-threatening. Most of the symptoms will include coughing, lethargy, exercise intolerance, and sometimes you may not notice any symptoms at all. Your pet should be tested every year for heartworm disease, sometimes even every 6 months, depending on how often you're giving the prevention at home. Once they're tested, they should be given a prescription of a heartworm preventative such as Revolution Plus or Simparica Trio, and what that does is prevent them from developing heartworm disease amongst other parasites as well. So if you're not given a monthly preventative to your pet, please contact your veterinarian or give us a call so we can make sure your pet doesn't suffer from heartworm disease. So this is a patient that I did a previous mass removal on. The mass was extremely large. Unfortunately, the pet got the cone or the e-collar off, and ended up eating the sutures out, and now we have an open wound. So we are going to repair it, fix it again, in hopes that the e-collar stays on this time. This is definitely preventable, but unfortunately sometimes it happens. So we'll get it taken care of. The owners will have to wait an additional 10 to 14 days for the incision to heal, and then hopefully we can get the cone off and the baby can go back to being perfectly normal. So I actually was leaving and I saw some pets come in, some dogs come in that wasn't neutered, and it made me realize that also not only are the medical issues not regulated here at the dog park, their spay and neuter status isn't as well. So technically we don't know which dogs are spayed, which dogs are neutered. They can get pregnant at a dog park, but more importantly, they can get into fights if they're not neutered. The male dogs typically are territorial, and it can be from a toy, a female dog, a scent, smell, or simply just their energy. So it is best that if your dog is not spayed or neutered, to not necessarily visit dog parks, because it can cause major issues. Why do most veterinarians ask you to spay and neuter your pet? This may shock you. It's not what you think. Most of the times we're recommending spaying and neutering to minimize on most health complications that you may not think of. We, of course, always do not advise breeding unnecessarily unless you are breeding for a specific purpose. But most pets, such as female dogs and cats, are privy to developing breast cancer, pyometras, which is a uterine infection, and both of these things can be life-threatening. So not only do you want to minimize reproduction unnecessarily, you want to minimize the chance of cancer, in addition to minimizing the need for surgery in regards to developing a pyometra. In male dogs, we also advise neutering them to minimize prostatic issues, which is issues with their prostate. They can also get anal gland cancer of the rectum. So these two things most often are life-threatening and will at some point cost them their life. So if you simply get them neutered, it is something that can minimize further health complications. Not only that, but if you get female dogs spayed before their first heat cycle, it's a greater chance at minimizing the development of breast cancer. The longer you wait, the more heat cycles they actually go through, there is a more increased chance of developing breast cancer. However, if it is a large breed dog, you do want to wait 1 year to 18 months before getting them neutered, because they do need the testosterone for bone development. So otherwise, we recommend spaying them around 5 months of age, just to minimize the chance of them going into a heat cycle and increasing their chance of developing cancer. One unexpected emergency with your pet, and it's a decision you'll have to make between putting your baby to rest or spending your life savings. Did you know that pet insurance exists? Pet insurance can save you from having to make such difficult decisions when your pet is in a medical emergency situation or potentially need emergency surgery. Pet insurance can lighten the burden of making hard decisions financially when your pet is in an emergency situation. You should have pet insurance, as cheap as it is compared to the benefit you would gain from actually spending less in the clinic. Did you also know that pet insurance offers direct billing, meaning they pay veterinarians directly and you only pay the difference? Sometimes you are faced with upfront costs that's $2,000, $3,000, $4,000, which most households may not necessarily be able to spend at that time. If you have pet insurance, it can save you a lot and also allow your baby to get the medical attention that's needed. If you don't have pet insurance for your pet, what are you doing? It's simple, easy, and inexpensive to get signed up. Please remember they also do not cover anything that is pre-existing. So you should get the pet insurance when the pet is very, very young and there is no medical issues. If you need help with this, call us, schedule a consultation, and we're happy to help you get signed up. How do you open it? Oh, there we go. I think I got it. All right, so today we're going to talk about dog poop bags. So as you can see here, I have on 2 poop bags here. Ideally, you want to make sure you have your own poop bags anywhere you go. This dog park actually is stocked pretty good, which is very surprising to me. I also walked the grounds, and the grounds look very good as well. So kudos to whoever's cleaning up the dog park. There is a donation that you can give to Freedom Barkway to kind of help with poop bags, but ultimately make sure you bring your own poop bags. Luckily today they're very stocked, so that's a good thing. Hey guys, so today we're gonna talk to you a little bit about anal glands in dogs and cats. Anal glands are 2 glands that sit near the rectum, and every time your pet has a bowel movement, they should express the anal glands. The anal glands are a scent gland, so every time the pet may have a bowel movement, it's used for marking territory. The fluid should be the consistency of water or similar to water, but if the anal glands aren't being expressed when the pet has a bowel movement, then that liquid sits there and turns into the consistency of toothpaste, which can yield an anal gland abscess in dogs and cats. So if your pet is scooting on the butt, licking the butt a lot, those are some signs that they may be having anal gland issues. So just pay close attention. It is cute, but it's also a sign that there may be something going on. So most of the time you may see the smaller dogs sit on their butt and use their front legs to drag themselves forward. That is a red flag that there may be an anal gland issue. Also food allergies, things that can kind of lead to a food allergy, you can also see on physical exam when we're examining them as well. So if you notice any of these things, definitely get them checked. Your groomer, if you go to the groomer often, you can request them be checked by your groomer or your veterinarian. So this is a stray cat that came in. The owners were able to trap him on last night. He is completely feral, is not used to being handled by human at all, which means that we have to sedate him to work with them. But unfortunately, because his adrenaline is so high, sometimes medications just don't work as well. So you have to be very careful also, because we can't listen to their lungs, listen to their heart. So you want to be careful with giving them medications without being able to assess them, because sometimes if they have an illness that does not go well with sedation, it can cause medical issues. But this is more of a safety type of situation, so you definitely can't handle the pet. Unfortunately, has to be sedated, but you just try to be as safe as possible. So he's being sedated so that he can get neutered. We can do a complete physical exam, look in the mouth, look for fleas, get a fecal or stool sample for parasite testing. There's no way we can do any of that without sedating him, so that's the purpose of the sedation. They recover very fast. I mean, you're talking days, maybe 24 hours. And this is an older cat, so it's very difficult. His testicles are kind of tough. He's very developed, so it's a little bit harder for me to exteriorize his testicles. 9 times out of 10, cat bite wounds turn into abscesses. They also transmit diseases when they get into fights. One called FIV, which is solely transmitted through a bite wound. So most intact male roaming cats may actually have FIV, which is similar to HIV in human. Once they get that, ideally they need to be in a single cat household, because their immune system may become suppressed, which gives them to multiple infections, recurrent abscesses, things like that. But ultimately, this cat looks pretty healthy with the exception of a couple of scratches and things like that. The owners are going to try to tame him, keep him inside. So we'll see how that goes. But as for right now, he needs a lot of work.
Watch how this doctor saved this dog from a ripped open wound.
So this is a patient that I did a previous mass removal on. The mass was extremely large. Unfortunately, the pet got the cone or the e-collar off and ended up eating the sutures out, and now we have an open wound. So we are going to repair it, fix it again, in hopes that the e-collar stays on this time. This is definitely preventable, but unfortunately sometimes it happens. So we'll get it taken care of. The owners will have to wait an additional 10 to 14 days for the incision to heal, and then hopefully we can get the cone off and the baby can go back to being perfectly normal. Do not give these medications to your pet, although you may be able to get them over the counter in a common pharmacy or grocery store. Number 1, NSAIDs. You should never give Tylenol, naproxen, ibuprofen to any pet, especially if they are in pain or have inflammation, because it can cost them their life. Definitely consult your veterinarian before giving anything. My recommendation is to not give anything at all over the counter, especially antidepressants, anti-anxiety medications, sinus medication like Mucinex D. All of these medications can definitely cost your pets its life. So don't give anything over the counter. If you see something that's concerning to you and you want to get your baby some help, simply call the veterinarian. At least ask them, is it okay if you give this medication? 9 times out of 10, we're gonna say no, and to just schedule a consultation so that we can see what's going on to prescribe the appropriate medication. So again, do not go to the store and give any over-the-counter medications, especially if you're giving them without asking a veterinarian first, because it can be detrimental to your pet's life and be very costly to treat. Stay safe. What are zoonotic diseases? Zoonotic diseases are diseases that you can contract from your pet. Some examples are cat scratch fever, leptospira bacteria, roundworms, hookworms, rabies, and for my pregnant women, toxoplasmosis. Toxoplasmosis is something that can cause abortions by pregnant women handling litter. So if you are pregnant, be sure you're not handling any cat litter at all. If you feel as if you have become sick from something that you contracted from your pet, be sure to schedule a visit with your primary care physician or even the ER, depending on what your symptoms look like. If you have pets, be sure you're getting your annual and biannual exams, because some of these things we can pick up as veterinarians on physical exam when we're examining your pet. Did you know your dog can die from getting bitten by a mosquito? One mosquito bite can cause heartworm disease to develop in your pet, and it can be, and most often is, life-threatening. Most of the symptoms will include coughing, lethargy, exercise intolerance, and sometimes you may not notice any symptoms at all. Your pet should be tested every year for heartworm disease, sometimes even every 6 months, depending on how often you're giving the prevention at home. Once they're tested, they should be given a prescription of a heartworm preventative such as Revolution Plus or Simparica Trio, and what that does is prevent them from developing heartworm disease amongst other parasites as well. So if you're not given a monthly preventative to your pet, please contact your veterinarian or give us a call so we can make sure your pet doesn't suffer from heartworm disease. So this is for my ladies. I never thought I would be talking about this on camera, but here we are. Did you know your dog can become obstructed from ingesting feminine products such as tampons and used pads? Most of the time they are attracted to the smell of natural scent that comes from menstruation discharge. If you are having your time of the month, you want to be very careful not to leave your products in the bathroom trash can, because your dog will go and ingest them. Not only is it embarrassing for my female owners, but a lot of the times they never know the pet ingested the feminine products. Often I end up going to surgery, finding the foreign object in the intestine and later identifying specifically what it was. Some owners are aware of the pet ingesting the feminine products, but most of the time they aren't. It can cause a severe obstruction and can cost them their life. The surgery is extremely expensive, and most of the time it costs thousands of dollars to even get them treated. So be very careful if it's your time of the month. Take the trash out immediately and monitor your pet to make sure they're not sniffing out the trash once you leave. Alright guys, so today I'm going to educate you all a little bit about linear foreign bodies in cats. Linear foreign bodies in cats are composed of things such as string, yarn, any kind of twine. Some cat toys may also have little strings attached to them. These little linear foreign bodies are deadly to cats if they are ingested. Most often, owners don't necessarily see the cats ingest these items, and ultimately the pet begins to decline. Most of the time we get them here in the hospital, they aren't eating, they're vomiting profusely, and the owners have no idea what's going on. Ideally, if we do find linear foreign body in cats, surgery is the only option. We have to go directly to surgery to make sure that the linear foreign body has not caused issues within the intestine. If nothing's done and the patient is misdiagnosed, don't get x-rays, don't get the surgery, there is a high chance that the pet will pass away. This is specific to cats that we see most often. So if you do have a cat and you allow your cat to play with yarn, string, twine, anything that's linear or long, you don't want to do that because it can be extremely dangerous and ultimately cost your cat its life. So find something else to play with other than the yarn, the twine, the string, because it's not a good toy for cats. Let us know if you have any questions about this by leaving us a direct message or comments below. All right, so we have this patient coming in. I did a previous cyst removal and had to place a drain. The owner is concerned because there is still a slight opening and she thinks she may feel a suture there. But it is a proper healing for the wound to heal from the inside out. So I'm gonna just look at the pet, make sure there's nothing to be overly concerned about. All right, so yes, as expected, the wounds that she's concerned about is just healing normally. She was just a little concerned because she could still see it a little bit open, which is normal after you place a drain. So it's really nothing that I need to do, just make sure that I took a look at it, just to make sure the owner's concerns were addressed. So today, guys, we're going to talk a little bit about parvovirus. Parvovirus normally affects puppies most often, but can affect adult dogs as well. It is a virus that lives in the soil, which is why we do not recommend taking puppies outside and placing them on the ground if they're not fully vaccinated. It is something that can infect your puppy and causes severe bloody diarrhea in addition to vomiting. Most of the time, there is a 50% chance that the pet may pass away and a 50% chance that the pet may live. Treatment can be thousands of dollars and it may not necessarily save the pet from passing away. If you have puppies, be sure that you're not taking them outside if they're not fully vaccinated. Your puppy should be receiving vaccines at least once a month for 3 to 4 months before being considered fully vaccinated. It is best to keep the pet inside, use puppy pads and crate training in order to prevent going outside onto the grass area. If you absolutely have to take the puppy outside, it is recommended to use concrete or hard surface that you can disinfect with bleach or some other cleaning product that actually kills parvovirus. So in summary, if you have a puppy that's not fully vaccinated, be sure that you aren't taking the baby outside and putting the sweetheart on the ground, because once the puppy becomes infected with parvovirus, it does cost thousands of dollars. There is a 50% chance the pet may make it, and it is extremely life-threatening. Alright guys, so today we are out of the office. We came to the dog park just to show you a couple of pitfalls and my reasoning for not necessarily favoring the dog park in regards to taking your pet to play and things like that. So number one, the first thing I see that's a major problem is I see a bucket of community balls, which means every dog plays with the same balls. So the issue is that dog parks aren't regulated, which means that no one's gonna check to see if you have vaccines, if you have fecal testing or any of that done. So you don't know what the pet may have when they come to the dog park. So one dog plays with the same ball another dog may play with. Look at that, perfect example. Had I brought my dogs to the dog park, my pet would immediately pick up the ball, which ultimately may be an issue if it has some type of contaminant on it. So that's not a good sign. Ultimately, if they do have kennel cough or something like that, it can be easily spread amongst each other if they're here. So this is a no-no for me. So I'm not a fan of dog parks at all. So if you are going to dog parks, do the best you can to make sure your baby is up to date on vaccines, and you don't want to use balls like this because they are dirty, and also you don't know what pets already had them.
Will you even touch the balls?
I'm not touching those balls.
Dog distraction.
I don't want to touch the balls. I don't want to touch the balls. Alright guys, so today I'm going to educate you all a little bit about linear foreign bodies in cats. Linear foreign bodies in cats are composed of things such as string, yarn, any kind of twine. Some cat toys may also have little strings attached to them. These little linear foreign bodies are deadly to cats if they are ingested. Most often, owners don't necessarily see the cats ingest these items, and ultimately the pet begins to decline. Most of the time we get them here in the hospital, they aren't eating, they're vomiting profusely, and the owners have no idea what's going on. Ideally, if we do find linear foreign body in cats, surgery is the only option. We have to go directly to surgery to make sure that the linear foreign body has not caused issues within the intestine. If nothing's done and the patient is misdiagnosed, don't get x-rays, don't get the surgery, there is a high chance that the pet will pass away. This is specific to cats that we see most often. So if you do have a cat and you allow your cat to play with yarn, string, twine, anything that's linear or long, you don't want to do that because it can be extremely dangerous and ultimately cost your cat its life. So find something else to play with other than the yarn, the twine, the string, because it's not a good toy for cats. Let us know if you have any questions about this by leaving us a direct message or comments below. This is my absolute worst nightmare. Share water sources at the dog park with unregulated medical conditions. Here, no one's checking for illness or disease, but every dog is using the exact same water source. There are contaminants that can live within water, even some that we can catch as human beings. So every dog at the dog park using the same water source is disgusting to me. I wouldn't allow my dog to drink out of this water source. To make it worse, they actually have water here for human as well. So I think I'll pass. What is this supposed to be? I don't even know. What is it supposed to be? A shared water bucket? So I guess you're supposed to take this and maybe fill it with water here, which is not good if we supposed to drink out of that. I can't do it. I just can't do it. Yeah. This is why I don't go to dog parks.
What's up, y'all? I'm Turner, an intern here at Paws Animal Clinic and Urgent Care. My favorite part of working here is the supportiveness around me, from Dr. Jackson to the technicians. They're also very patient with me, learning throughout the process, being so raw in the field, and obtaining new information daily. The craziest thing I witnessed was probably an animal came in that ate a sock, I believe. So I was in there during surgery and I got to see the small intestines and the opening of the duodenum and the removal of the sock and the suture process afterwards. My favorite breed would probably be a golden doodle, because when they come in, it's often almost a problem with them all the time. So it's pretty cool to get the history and learn more about them. My dream animal to treat would be a husky. That's my favorite dog I want to own eventually. So yeah, I learned a lot since first coming here. I started coming here late 2023, early 24, and I was very new in the field, but Dr. Jackson took me in with open arms and often teaches me new material daily, and we go deep into the history, and he forces me to learn and think in different ways that I'm not used to, which is good. And oftentimes we'll narrow down the history and what the best diagnosis is for the animal. Lastly, if you guys have any animals, pets with any problems, don't hesitate to bring them on by and we'll get them checked out.
Yeah, so this is a French bulldog that I actually saw last week. She came in for this twitching type behavior that you see here. Initially, I suspected that she may have a little bit of back or neck pain, but unfortunately the owners couldn't treat at the time or do diagnostic testing, so she's back. So we'll see, you know, if there's been improvement. Hopefully we can get some x-rays and kind of see if we can figure out what's actually going on. In this case, unfortunately, the x-rays were a little bit too expensive, so we did elect to treat. Sometimes we end up having to do more advanced imaging, such as an MRI or a CAT scan to identify the problem, and that can be quite pricey, so all clients may not have the funds to take care of things like that. So we just treat the symptoms, see how the pet responds to that, and in about 3 to 5 days, they'll call me with an update, but hopefully she gets better and goes back to normal. If not, unfortunately, we will have to figure out how we can get advanced imaging, such as an x-ray, MRI, or a CAT scan. So we'll see how she does in about 3 to 5 days, and we'll give you all an update. This baby is about to go to surgery to get a mass taken off that's growing extremely fast. It is in a really tough spot. It's kind of big, so I'm hoping that I have enough skin to actually close it appropriately. I'm not sure if it's cancerous or if it's benign, but we'll send the entire tumor in to the pathologist for a biopsy. So I'm sterilely scrubbing. We call it a surgical scrub, but we are trying to minimize the bacteria that's on the skin before we actually do surgery. You have to be careful because this mass is very close to the eye, and we can't use certain products around the eye because it can cause corneal ulcers. So I'm holding the actual eye closed while I'm trying to sterilely scrub the mass so that I can actually do surgery on it. So I'm trying to see how I can go about removing it with saving as much skin as possible. However, you don't want to leave any aspect of the mass there because there may potentially be a chance of regrowth. So I'm gonna do the best I can. The reality is that sometimes you just can't get good margins, but you just try to do the best you can. So now the challenge is going to be suturing without having too much tension on the incision. All right, so this baby came in on last week for a separate issue, but on physical exam, I noticed that the breath was stink very badly. So did an oral exam and noticed the sweetheart had a fractured tooth. So we definitely need to get that taken care of because it can lead to further complications such as heart disease, liver disease. The extraction went well. We got the tooth out with no issues. The technician's finishing up getting the teeth clean, and the baby should go home with minimal pain, maybe a little bit uncomfortable for 24 hours, but we should be good to go in about 2 weeks. I also noticed that there are oral ulcers on the hard palate in the mouth. For the owner, I'm gonna recommend that we kind of follow up. I'll recheck the ulcers at the recheck appointment, but we also wanna make sure the baby's not eating bones that's too hard, because there are a couple of other worn teeth that's just about fractured as well. So no hard bones for this baby until definitely the incision site heals, but ultimately you don't want to let them wear their teeth down by chewing too much on hard items. So we'll monitor that, see if the ulcers heal up just fine, and then kind of go from there. Her ear is pretty ulcerated, painful. It's got a bunch of debris in it, so we don't know if it's yeast, bacteria, etc. Most times this breed has allergies, so if we don't treat the allergy, the ear infection just tends to get worse. Based off of her teeth, she looked pretty young. Yeah, so she's a pretty young dog. Ear infections are quite common. She need an ear cleaning.
Yeah.
So we're just trying to get her ears cleaned. It's already pretty irritated and kind of ulcerated, but it can be quite painful, so you want to be extremely gentle because sometimes they don't let you touch them at all. She's doing pretty good.
Good girl, Pearl.
It's only on one side. Normally if it's allergies, it's bilateral, so they have issues on both sides. So I'm not sure what caused the ear infection, but she pretty much has a really bad yeast infection in her ear. So we'll get an antifungal medication because yeast is a fungus to treat the ears. Sometimes if they have underlying allergies and the allergy's not treated, then it ultimately just comes back again. So we'll have the owners monitor for symptoms of allergies. But as of today, mom says we don't lick the paws or anything allergy related. So this is the first ear infection, so we're just gonna treat it, see what happens. But if it becomes recurrent, at that point we may need to do a little bit further investigation.
I just paid $170. Yes, you. $170 because your thing want to get swollen and not go back in. So we paid $170 for the vet to put lube and sugar on your thing. You got touchy, you got a happy ending with some lube and sugar for $170. You gonna go in this house and go to sleep. Are you serious, Ricky?
Okay, so this looks like a bulldog or a brachycephalic pet. It sounds like what she's explaining is a penile prolapse, which means the penis, the tip of the penis actually prolapses, and it looks like it's similar to a donut, and it actually bleeds. Most of the time it's a male dog. Of course it has to be a male dog with a penis, but a dog that is not neutered, and sometimes they have a habit of humping, whether it's on a teddy bear, the couch, or people in general. The hormones cause them to become erect to some degree, and it prolapses their penis pretty much. So we use lubricant and sugar to minimize inflammation and to reposition the prolapse, and sometimes we even have to suture it in place. So if you're not going to breed your male dog, it is advisable to get them neutered so that you don't have to deal with this. It is something that can happen over and over and over again, which can be problematic for pets, and it also causes a significant amount of bleeding around the house. So again, if you have a brachycephalic breed that is not neutered, you may want to go ahead and take care of that so that you don't have to deal with issues such as this.
Lube and sugar. on your thing.
Her ear is pretty ulcerated, painful. It's got a bunch of debris in it. So we don't know if it's yeast, bacteria, etc. Most times this breed has allergies. So if we don't treat the allergy, the ear infection just tends to get worse. Based off of her teeth, she looked pretty young. Yeah, so she's a pretty young dog. Ear infections are quite common. She need an ear cleaning.
Yeah.
So we're just trying to get her ears cleaned. It's already pretty irritated and kind of ulcerated, but it can be quite painful, so you want to be extremely gentle because sometimes they don't let you touch them at all. She's doing pretty good.
Good girl, Pearl.
It's only on one side. Normally if it's allergies, it's bilateral, so they have issues on both sides. So I'm not sure what caused the ear infection, but she pretty much has a really bad yeast infection in her ear. So we'll get an antifungal medication because yeast is a fungus to treat the ears. Sometimes if they have underlying allergies and the allergy is not treated, then it ultimately just comes back again. So we'll have the owners monitor for symptoms of allergies. But as of today, Mom says we don't lick the paws or anything allergy related. So this is the first ear infection, so we're just gonna treat it, see what happens. But if it becomes recurrent, at that point we may need to do a little bit further investigation. All right guys, so today we're gonna talk about something that I think a lot of clients forget about. It's very important and it's going to have involvement with your annual exams. So every time you go to the veterinarian once or twice a year, vaccines are definitely important, but for older pets, x-rays and lab work is also just as important. The reason why x-rays are important is because we can catch things such as bladder stones, kidney stones, abdominal masses. A lot of times we can catch enlarged hearts, anything that may be visible on an x-ray. If you happen to not do the x-ray at the time of the annual exam and your pet may have an abdominal mass or heart enlargement, etc., it may be easy to miss because we can't see inside of your pet's body. So that x-ray will allow us to rule out the common causes of illness in older pets that may be able to be caught on an x-ray. When we recommend lab work, we can catch things such as kidney disease, liver disease, anything that may show up on lab work that may point us to say, hey, you know, this is a little abnormal. Maybe we need to recheck in 2 weeks. Or it may be something that's pretty important or more of an emergency, such as diabetes and things like that. So you want to make sure not only are you getting annual vaccines, but I know it can be quite expensive, but you want to make sure you get the x-rays and the lab work as well, because those are things that can rule out life-threatening issues. So don't skip those. They're very important. This baby is here because the owners are moving to Spain, and all pets will need a health certificate, international health certificate, in order to be admitted to the country. Every country has different requirements, so we had to research to see what was the requirements for Spain in order to get the health certificate approved by the USDA. So we're just going through the protocol of things we need to do. We'll submit the health certificate to the USDA. They will look for errors and then hopefully they'll go ahead and approve it. Most health certificates has to be issued within 10 days of travel. If there's anything wrong, the owners can get stopped at the border, deny entry with their pet, and it can be quite expensive. So it's a big deal. Before traveling, one thing you definitely want to make sure of is that your pet gets a health certificate, because it's something that's required most of the time in between states, but most definitely in between countries. If you happen to travel without a health certificate and you get caught or stopped by the police or any authority and you don't have it, you can be fined and denied entry into wherever you're going. So just make sure you get your health certificate for your pets. Speak. Down. Target. Good girl. All right, guys, summer's almost here, so there are a couple of tips I have for you. The first in regards to cats and dogs is parasite control. That includes fleas, ticks, and GI parasites. You definitely want to make sure your pet's on a heartworm, flea, and tick preventative, along with gastrointestinal parasites, especially if your pet goes to doggy daycare, boarding, or dog parks. So parasite control can consist of one treatment, but there are a lot of different treatments online, so consult your veterinarian about which one they recommend. Summer tip number 2 is heat stroke. Make sure your pet is not kept in an environment such as a car or a house with no AC or any place where the temperature can be elevated, especially those Brachycephalic breeds. Those are breeds with the short snout, such as French bulldogs, just regular bulldogs, pugs. Any of those breeds can overheat very easily. Be sure that there's always water if they're outside, and just make sure they don't overheat. Summer tip number 3. Be sure that your pet does not burn their paw pads by walking on hot concrete. So if you are a runner, a jogger, you take daily walks with your pet often on hard surfaces such as concrete, you may want to invest in booties to put on their feet just to make sure that their paw pads are protected. Summer tip number 4. Leptospira bacteria lives in standing water. So if you go hiking, goes to the dog park that has water there, if you have standing water in your backyard, be sure that your pet is vaccinated for the Leptospira bacteria. It is zoonotic, typically fatal if your pet happens to contract it, and it can be transmitted to human as well. Summer tip number 5, if you have swimming pools at your home, be sure that if you have a blind pet such as Claire here, they aren't able to access the pool because they will fall in. Not all dogs can swim, and some dogs will drown. Not necessarily that the pet cannot swim, but if they happen to fall into the swimming pool and they're swimming for hours and hours, they do get exhausted, and at some point they will give up. And if you're not there to catch it, typically, unfortunately, they will drown. Last but not least, there are some holidays coming up, such as 4th of July, Labor Day, etc. So if you're cooking, barbecuing, grilling, frying fish, anything that you may do on holidays that may include food sources that's not necessarily dog food, be careful. If they happen to ingest human food, it can lead to pancreatitis, vomiting, diarrhea, and sometimes, unfortunately, life-threatening gastrointestinal obstructions. All right, so this summer, make sure you and your pets have fun, be safe, and just keep your eyes open for the things that we've mentioned in this video to make sure they don't end up in the hospital to see me. All right, some things you would want to know when you get your first puppy. The first thing is you want to know your breed. Certain families may or may not do well with certain breeds depending on their lifestyle. So French bulldogs compared to a German shepherd. This actually is an Australian cattle dog. They need a lot of exercise, a lot of entertainment. Myself, I used to rodeo, so that's what I actually used her for. She's a little bit older now, so she's more sedimentary, but you want to know your breed. If you have more of a relaxed lifestyle, you don't want to go and get a more energetic dog because that's going to be a nightmare. When you get your first puppy, you want to be careful and select one of the best foods for the breed. When they're younger, you may not be more prone to knowing if they have allergies or not. That typically doesn't come until later. So you want to just make sure you get a complete balanced diet, a veterinary recommended brand, and preferably stay away from grain-free diets. The top 3 diets I recommend is Royal Canin, Purina Pro Plan, and Hill Science diet. When you get your new puppy, although you may not necessarily keep your baby in a crate, crate training is preferred for reasons such as traveling, if you're going on airplanes, if you're boarding, or if you have to bring your baby to the vet. If you don't crate train, it can give them anxiety once they are placed inside of a crate. So although they may have free range to your home, make sure you actually go through crate training. Crate training also is the easiest way to potty train your pet as well. Another thing that's important when getting your new pet is obedience training. You want to make sure your pet is actually listening to you, know the common commands such as sit, stay, leave it, down, so that when you go out into public or if the baby comes into the vet hospital, when we are speaking, they actually know what we're saying. Some pets who may not understand our language because they didn't necessarily learn it at home can be problematic in public and sometimes cause anxiety to others. Lastly, when you get your new puppy or kitten, you want to make sure you're aware of what their medical needs will be and what their medical needs are. Certain breeds may require certain things such as sunscreen application, cleaning of skin folds, just different things. So you just want to make sure you're aware of what they need. Most kittens and puppies will need to be seen at least 2 to 3 times monthly, 2 to 3 times within a 4-month period, just to make sure they get all of their vaccinations, their deworming, their fecal testing, things like that. Normally, once we see them for their initial vaccine appointments, they go into a biannual visit or an annual visit. So initially, when you first get your baby, you're gonna spend a little bit of money on vaccines just to get the baby up to date on everything, and then we'll start seeing you once or twice a year. Stop number 2 at the dog park. One thing I see that's concerning to me is this hard brick here. I've actually seen a pet chase a ball and accidentally run into the wall and ultimately had to leave to go to the ER. So although it is a dog park, it is outdoors. This is just not one of my favorite things to see here because I have seen dogs injure themselves. Also, the hard rock here, they can easily injure their paw pads, their nail beds, different things like that. So ultimately we are outside. You just have to be very careful about where you let your pet go because it can cause a health issue. I personally recommend trying to find an open field, maybe level ground, nice manicured grass. But when you find things like this, it can cause issues with their paw pads, their joints. Some dogs may have arthritis, hip dysplasia, so you just don't know what the pet may be dealing with. So this is not my favorite. I would ideally recommend finding a large field or something of that sort. Truth or myth, Soft Paws Animal Clinic Edition. Yes, there are some hairless pets, hairless cats, hairless dogs that you should be applying sunscreen to, especially if they are exposed to the sun and the environment. But yes, pets can get sunburn. No, you should never use human medicine in a pet without consulting your veterinarian. Some human medications can definitely be toxic to pets. Not necessarily. Dry nose can, aid in giving us a status on how hydrated they are, but it does not necessarily mean that they're dehydrated just because their nose is dry. There are some medical conditions that can cause dry nose as well. So it's a myth, but it can give us some information. Yes, spaying and neutering your dog is very important, not only to minimize reproduction, but ovarian cancer, prostate cancer, anal gland cancer is also very common in animals. So spaying and neuter is not just to prevent reproduction, but to also minimize cancer as well. Females can get a uterine infection called a pyometra, which is definitely life-threatening, and it's thousands to actually treat. So spaying and neutering your pet at the designated time it'll save you a lot of money. Is your dog limping, don't want to go up and down steps, or even slowing down? If your dog does any of this, it's possible that your baby may be suffering from arthritis. 1 in 5 dogs over the age of 1 may be dealing with arthritis, and some symptoms may be pain, stiffness, and mobility issues. Things that further complicate arthritis may be obesity, sometimes chronic inflammation, hip dysplasia, and any systemic infections that may cause the body to remain in an inflamed state. If your pet may be dealing with any of these symptoms or signs, or you're noticing the symptoms at home, definitely give us a call because your baby may be dealing with arthritis. Call us here at 678-277-4999 because we're happy to help.
You smoke weed? You like edibles?
Wait,
That Mary Jane?
do you smoke weed? Do shrooms?
I didn't record. I'm not being funny.
I feel like I
Really?
Yeah.
Action.
And action. Quiet on set.
Are among the most common animals that get. We're gonna start over. Hold on, I just got it. Start over, Omar.
Oh shit.
Sometimes it do predispose them to developing.
Cut.
And it is extremely life-threatening.
Cut.